Hi, it's Amanda Edwards here from OnePassport. I'm the Director of Health and Ageing, and after discussion with Jodie Davis, I have put together a little proposal for OnePassport to support nurses to carry around their important information, so their vaccinations, immunisations, all those sorts of things, along with registrations, permits, etc. And we'll talk a bit more about that in an easily accessible format, because this is currently kind of a big problem for nurses. Just a little bit about me. I'm a critical care emergency nurse. I've worked as a health executive, advisor, etc. I lecture on clinical leadership. I also work for a software company. There you go, quite diverse. And I am in charge of sales and implementation at OnePassport with health services. And I am also a full-time ANMF member and have been for a lot of years. So I know a little bit about what ANMF is about and how they like to support us as members. And so I thought this was something that would be really useful for the ANMF and for nurses as members. So who's OnePassport and why would you work with them? OnePassport's a Melbourne-based software company, and what we do is look at workforce compliance, so all managing really staff compliance. We've done a lot of other things since COVID came about, done job match programs and all sorts of things, because the system is quite unique in it has the person at the centre and the system as something that hooks in, so that basically you can walk and plug in your passport to the organisations that you need to connect with. We're Australian owned and Australian born and bred. We're growing quite fast now, particularly since COVID's come about because of our immunisation register and so forth. We have a lot of industry representation, so we kind of keep our ear to the ground, and it's developed, all our software is developed with the user experience in mind. So if we think about how that applies to nurses, nurse compliance and credentialing, it's the new COVID normal that we're now working in. And nurses already worked in one of the most regulated sectors of the workforce. We've got lots of elements to our lives. We've got our family lives, then we've got our professional development, we've got the requirements of employers. We already had a requirement to provide health screening information, but we didn't necessarily, it didn't have the importance that it now has. We have lots of different, we work in lots of different areas, so it might be acute or aged care. We might work in management roles, in clinical roles. So there's just lots and lots of scenarios where we need different types of professional compliance to meet the requirements of the work. Nurses move jobs relatively frequently and often, like myself, work for more than one organisation, and so it's important that we keep our CVs up to date and all of those sorts of things as well. We're pretty busy. We're generally, we have lots of family engagements. All the nurses I know wear many hats, and they don't want to waste time looking for their compliance information, and it's always in a safe place and never available when you need it. Typical compliance requirements for nurses, as you know, are police check, working with children check, just having your qualifications in there, your immunisation, maybe your Hep B serology. Now we've got mask fit testing, COVID tests, you might have those in there as well. Visa and right to work information, languages, multicultural society, it's useful to have your languages if you have certifications for those, your registrations, your licenses and other permits that you might have, as well as professional development. So what's useful for us is something that provides a CV that updates automatically, that keeps this information in a place that's easy to access, that's safe, secure, and you can show it and share it easily and quickly. having a printable immunisation certificate might be necessary as well. We want somewhere to store everything, and we need the ability to share and verify information when needed. For example, a police check needs to be a verified police check. We know that the ANMF is the #1 advocate for nurses, and you're always seeking to provide value for members, and also as part of your charter, use relevant technology to achieve those objectives. A strong emphasis on education and support advocacy for nurses as a profession. So how could we as OnePassport help ANMF members? Well, we want to provide members the free OnePassport profile app. And as you can see here, it's an app that you carry on your smartphone. What does it do? It does a lot of different things. You can see here, this is the immunisation side to it. And I will just run this little clip. So this just shows you running through from the dashboard. Down the side, we've got a CV builder. You can scan to connect to different organisations. Use CV check to buy a police check. Here's your qualifications. You have a document there. You can see up the top, it says share to an organisation. And we just click those and away it would go. Education history, and all of this information is pulled through to the CV. So you can add your CPD, registrations, licenses and permits, employment history. And this is great because you can just keep things updated all the time. Have your background checks in there, residency and visa, and your immunisation register. You can see I've got quite a few here. And again, it's quite easy. Just click and share to send it to the organisation that you're connected to. Add some miscellaneous skills and away you go. That's been the little overview for you. I guess the proposal that we're offering is that we would like to offer this to the ANMF to send out to members as a place for nurses to share, verify and store their information. We would see that the ANMF would offer OnePassport profile to members via their usual communication channels. And it's a bit of a win-win for both parties. So it becomes a member benefit, something that you value add for ANMF membership. And it raises awareness of OnePassport, which is, an Australian company. We would be happy to further support the ANMF by running webinars on workforce compliance as it pertains to nurses, and also how to use the app or anything else that the ANMF thinks that our expertise could assist with. So a little bit more about where we came from. The founders came from education and medicine, and I'm from nursing, obviously. Regulation, rising costs of non-compliance, mobile workforce with multiple employers, and a rise of the sharing economy. So it's also, we're trying to automate, and this is something that a pandemic has pushed on all of us, is the digitisation of lots of analogue industries. More and more employers are needing a quick and easy way to provide this information, to get the information off their employers. What we want to do is make sure that that is a safe place, and that people own their own data and they've got control over it. So with OnePassport, it's your data and it's your way. So people can't see it unless you choose to share it with them. So it's also always improving. The immunisation vaccination certificate arose out of the fact that we work with the community service industry, and they were talking about how homeless people don't have vaccinations. They don't have smartphones, they don't have credit, so it's not something they can do, but we can provide them with the ability to print out their vaccinations straight from the web browser, for example, by going to the library or by accessing it through social services. So that was a solution that was born out of that. So we continue to evolve with feedback from our clients. Obviously, privacy and security is really important to people. It's important to me. It's a private information, so it comes under those compliance systems. We comply with the various privacy acts in Australia and with the GDPR in, overseas and so forth, and currently working to our ISO 27001 accreditation with PricewaterhouseCoopers, and that work is going very well, and so far we are passing everything with flying colours. So we pride ourselves on people having control over their data and it being very safe and secure. These are some of the people that we work with: aged care facilities, hospitals, health services, government services, Australia, pathology departments, PricewaterhouseCoopers, lots of people that we are involved with, and as a growing company, we're really excited to expand that number. So I guess the next steps that we'd like to see is to make a meeting to discuss any opportunities or where we see some synergies for working together. Happy for you to contact me directly using my phone number here and my contact details. And thank you for listening. I hope to be in contact soon and set up a time. Thanks very much. Bye.